So, Glenn, statistics have shown that psoriatic arthritis affects about 30% of people with psoriasis, and currently there is no definitive diagnostic test for this disease. Can you share with us your experience of your path to diagnosis?
Well, I didn't develop psoriasis till I was about 30. And then it was scales on my back. And it was originally diagnosed as eczema. And the psoriatic arthritis developed about 5 to 7 years later. And I was already, my mid 30s. And it's funny that you say that it's not diagnosable because when I went to finally found my two doctors who've treated me all these years, they knew what it was right away, but they were experts and I was lucky to get to see them. It was Dr. Mark Liebwall and Dr. Stephen Paget, and they both treated me together. One's a rheumatologist and one is a dermatologist. But there was a little frustration before I got to them just because it was hard to convey how serious it was for me. Some doctors wanted to treat it a little more moderately and not as aggressively as Dr. Liebwall and Dr. Paget.
Can you tell us about what kind of treatments that you did try and how long it took you to find the right treatment?
Well, I embody about 3 generations of treatments for psoriatic arthritis. By the time I got to Dr. Liebwall and Dr. Paget, I was on crutches. I couldn't get into my shoes properly. I had what was called a sausage effect, which meant that my toes would just swell so much that like I say, I couldn't get into my shoes. It was hard for me to move my neck, hard for me to hold a pencil, hard for me to type. So I was quite a mess. And this is in the early 90s. And at that time, we used a variety of oral medications. NSAIDs was one group, and there were others, methotrexate, cyclosporin, which might have worked well, I'm sure, for many patients, but I had no luck with them. And of course, there were the topicals, and that was futile in many ways. Then I had light therapy. You go into the light box and wear these cool sunglasses, and hopefully that treats it, but it didn't in my case. And I had infusion therapy. The real revolution for me and people like me, I'm sure, was the development of biologics, and that was in the early zeros or aughts, they're called, I believe. And those are the medications that one injects into oneself. And that's what made a tremendous revolutionary difference, because I was able to walk without crutches. I was able to get involved with athletics. Well, let me not exaggerate. I was able to get on a field and catch a ball, but that was a major step. And those medications work remarkably well, Humira and Cimzia. And but one thing I do want to note about this, and this is something that doctors and patients should be aware of. In my case, and again, I'm sure I'm not the only person that had this, these medications are miraculous, as I said. But after 6 or 7 years, in my case, they became less effective. That doesn't mean they weren't helping me, but they weren't as efficacious as they were at the start. So what I had to do was change medications, but that's not such a bad thing because there's plenty of other biologics out there. And I was able to find others that suited me and kept me at the kind of level that I wanted to remain at.
You mentioned
Yep.
previously how the disease affected your how you functioned in your everyday life. Can you share some more about your experiences
Oh
and
yeah.
how
Well,
arthritis
so
affected your personal and professional life?
what I want to say about my professional life is I'm an editor and a writer, and I write book reviews. And I had an assignment from a very big company to do a book review, and I couldn't do it. Now, had I not read the book? No, I read the book. Did I not have anything to say? I had plenty of things to say. Couldn't do it because my hands were so swollen I couldn't type. So I lost that job, and it wasn't personal. It was just you have to get someone who can type. And unfortunately, at that point, I was very debilitated. Couldn't even hold a pencil. As far as personal things go, the big drawback, of course, is that, well, you're in pain for one thing. Uh, the plaque you have is unseemly. You're shedding and you itch a lot, bleed a lot. So, I mean, that's not pleasant, but that's part of it. and you can't keep up with your friends. And I like to go out with groups, and it was very hard to do so. So naturally, it's easy to feel left out of things when you can't when you're hobbled by psoriatic arthritis.
Thank you for that. So, from the patient's perspective, do you have a message that you would like to convey to our participants today regarding how they can motivate their patients if any treatment doesn't work, and possibly encourage them to try the different recommended treatments as well as adhere to these long-lasting treatments?
Oh yeah. Well, I certainly do, and I think the first thing I'd like to impart is that there's never been a better time to develop psoriatic arthritis. Now, that might sound like a silly thing to say, but it's not at all, because the treatments are so vast and so many of them have been so successful. I mean, there are ones that don't work, I have no doubt, but there's just such an assortment of successful treatments that I think people can be optimistic that they're going to find something that works. Maybe not the first or second time, maybe not the third, but possibly the fourth, because there's just a whole, it's like a candy store of biologics. I mean, there's going to be something for everyone. So I think that is very important. And I think if I can tout a group I'm involved with, the National Psoriasis Foundation, they also include psoriatic arthritis. They have support groups, and they're very active in lobbying legislators on passing bills and laws that benefit people with these illnesses, basically for insurance coverage and that sort of thing. So there's help out there. There's a community. There should be less shame in this because of that very vibrant community. And I'm optimistic. I mean, I managed, and I'm sure people coming up now and having this illness are going to do just fine.
Great. Thank you so much for your time, Glenn. We really appreciate it.